Dr. University, our world
distinguished Director General, distinguished Director General,
Madam President,
Assalamu alaikum.
Distinguished delegates, as our first item today, I would like us to adopt the draft of the third report of Committee A. I should therefore give the floor to our rapporteur, Professor Dimitrov, who will read the report in question. Professor Dimitrov, you have the floor.
Thank you, Madam Chair. Third report of Committee A, draft. Committee A held its 10th and 11th meetings on 29th of May 2021, chaired by Dr. Adriana Maria Paraguay. It was decided to recommend to the 74th World Health Assembly the adoption of the attached resolution relating to the following agenda item. Pillar 1 billion more people benefiting from universal health coverage. Agenda item 13, a review of and update on matters considered by the Executive Board. Agenda item 13.4, global strategy and plan of action on public health, innovation, and intellectual property. One resolution entitled Strengthening Local Production of Medicines and Other Health Technologies to Improve Access. Back to you, Madam Chair.
Thank you, Professor Dimitrov. I understand the committee is willing to adopt this report as read out. Are there any objections? I see no one. The report is adopted. We will now return to agenda item 17, public health emergencies, preparedness and response, and 18, mental health preparedness for and a response to the COVID-19 pandemic under Pillar 2. 1 billion more people better protected from health emergencies. The grouping in question is World Health Organization's work in health emergency and training preparedness for health emergency and mental health preparedness of and response to the COVID-19 pandemic. When we suspend our debate on Saturday afternoon, there were still some members of states with their hands raised. Could you please raise your hand again now to indicate you wish to speak? I would now like to give the floor to the moderator to manage the list of speakers.
Thank you, Madam Chair. I would like to invite Brazil to take the floor, followed by Chile.
Thank you very much, moderator, and thanks, Chair. Very quickly, we are proud to announce that Brazil is co-sponsoring both the resolution on strengthening WHO preparedness for and response to health emergencies proposed by the EU and the decision proposed by a group of countries which calls for a special session of the WHO next November to consider developing a WHO convention, agreement, or other international instrument on pandemic preparedness and response. Thank you.
Thank you, Brazil. I now call on Chile to take the floor, followed by Iraq.
Hello.
Good morning. Good morning to all. Regarding the draft decision, the extraordinary meeting of the World Health Assembly to consider the drafting of an agreement or other international instrument of the WHO on preparedness and response to the COVID-19 pandemic. We would like to highlight that this work was based on the need to be able to deal with future pandemics, and this in solidarity within the multilateral framework of the WHO, and this is in addition to other international coordination efforts. This World Health Assembly is taking the first step in this direction by granting a mandate to a potential working group on the strengthening of healthcare systems, and this would lead to an internationally legally binding agreement or instrument. We hope that we will be able to assess the work in November. We would like to urge all countries to start negotiations and to coordinate their efforts to come to the special session with a joint version that will allow us to advance and take decisions on processes that are necessary in developing this international instrument on pandemics, and that will reinforce the global health structure. Thank you.
Thank you, Chile. I now invite Iraq to take the floor, followed by Maldives.
شكرا جزيلا رئيسة. نحن نؤيد القرار المطروح.
Thank you very much, Madam President. We support this resolution on the response to pandemics. Despite the level of preparedness and response which differs from one country to another in our region, our countries and our region has done a lot to protect our populations. In fact, we have continued to put into place preventive measures in order to guarantee the health and safety of all of our citizens, and we have really strived to provide vaccines to Iraqis in order to bring an end to this pandemic. In fact, a ministerial team was established at the very beginning of the pandemic to focus on the way in which we could collaborate with other stakeholders in order to provide vaccines and distribute them and to administer them. And we are a part of the COVAX facility, and we have also tried to ensure to concentrate more on at-risk populations. And we have also ensured that once we received these vaccines, to distribute them at all levels of our country, in all governorships. Thank you.
Maldives, you have the floor.
Thank you, Madam Chair. The Maldives aligns itself with the regional intervention made by Bangladesh and wish to express our appreciation to WHO Secretariat for preparing the report on mental health preparedness and response to COVID-19 pandemic. People with mental and psychological disabilities represent a significant proportion of the world's population. They suffer from a wide spectrum of disease and conditions, including depression, suicide, particularly among the young, and are responsible for a staggering toll of death and disabilities. While the economic burden of mental health disorders has been estimated to account for a third of the projected $47 trillion by 2030 for all NCDs, the suffering and loss endured by people afflicted with these disorders are incalculable. stigma, and discrimination targeted towards those suffering from the mental health conditions continue to be widespread, worsening an already dire situation and harming their basic human dignity. Madam Chair, in Maldives, mental health did not become a major policy priority until as recently as 2018, when it was included in the President's 100-day pledge of the current government. Understandably, and despite the renewed focus in this area, mental health system faces numerous challenges, including an acute shortage of trained mental health professionals. Most of the professionals in this area, our services are concentrated in the capital island, Male. Limited and uneven access to people living in the outer atolls. As such, the mental health services in Maldives are unable to adequately cater to mental health needs of the people, especially those living in the rural islands. The COVID-19 situation has deteriorated the mental health situation further. The initial anxiety experienced by the people due to fear and uncertainty of COVID has now escalated due to long isolation, limited social interaction, loss of economic status and livelihoods, taking a huge toll on mental health and well-being. Survivors, family members that have lost a loved one to COVID, caregivers or health professionals responding to the pandemic are likely to experience psychological distress, sleep disorders, anxiety, and post-traumatic stress disorders, which can progress to such suicidal ideation, substance abuse, and reduced quality of life. Maldives, being a recipient of expatriate workers, accounting to a large proportion of our overall workforce, we have experienced how challenging it is, especially to the more vulnerable groups among the expatriate community, to cope with mental health issues during this pandemic. Madam Chair, given the critical situation with COVID-19, it is crucial to prioritize the actions to minimize mental health consequences of the pandemic and incorporate these actions into emergency and disaster risk management strategies for better prevention of risk to mental health and reducing existing risks. We as individual countries and WHO regions can collaborate and cooperate in these critical areas through synergy and shared knowledge. In this regard, we appreciate the continued support from the WHO Southeast Asia Regional Office and partners working in the region. Maldives strongly supports the resolution proposed under this agenda item. Thank you, Madam Chair.
Thank you, Maldives. There are no further requests for the floor from member states. And so, in conformity with Rule 47 of the Rules of Procedure of the World Health Assembly concerning the representatives of the United Nations and of other international organizations, I would like to give the floor to IOM.
Honorable Chair, Director General, distinguished delegates, ladies and gentlemen. The COVID-19 pandemic, the mitigation measures, and the resulting negative socioeconomic and social relational consequences have affected, are affecting, and will affect the mental health and psychosocial well-being of many people worldwide. Persons in vulnerable situations have faced and will face additional stressors and challenges. This is particularly true for migrants, asylum seekers, refugees, internally displaced and mobile populations, for whom the negative effects of isolation, limitation of movements and stigma have been squared, and whose access to mental health care was already hindered before the pandemic by legal, administrative, financial, logistical and cultural obstacles. For these reasons, IOM strongly supports the Mental Health Action Plan 2013-2030 and its call for increased awareness, for the allocation of adequate funding, for mainstreaming relevant competences in other health and social care sectors, and for building capacity to respond at the community level. In this process, IOM will continue to advocate and be vigilant so that these efforts do not leave migrants, refugees, asylum seekers, internally displaced and mobile populations behind, and that the mental health care systems will be legally inclusive of all migrants, irrespective of status, logistically accessible and known to migrants, and aware of cultural differences towards a truly universal mental health and health care coverage.
Microphone for the speaker, please.
I now invite the World Organization for Animal Health to take the floor, followed by UNFPA. I now invite UNFPA to take the floor.
Thank you, Madam Chair. UNFPA welcomes the updated Comprehensive Mental Health Action Plan 2013-2030. The COVID-19 pandemic has major direct and indirect impacts on the mental health and psychosocial well-being of all people, in particular frontline health and care workers and those in vulnerable situations who have been disproportionately affected by the pandemic, including adolescents and young women and people caught in humanitarian and fragile settings. In the midst of this crisis, UNFPA underscores the gender impact of the pandemic, including the highest rates of domestic and gender-based violence globally, and setbacks in efforts to eliminate harmful practices, including female genital mutilation and child early and forced marriage. This violence against women and girls exacerbates pre-existing risks, vulnerabilities, and inequalities that result in poor mental health, with long-term implications for personal, relational, and societal well-being. As evidence suggests, gender and sexual reproductive health and rights are also related to many aspects of mental health. The gender-related nature of the most common mental disorders becomes even more apparent as high rates of depression, anxiety, and comorbidity that predominantly affect women and girls are strongly linked to sexual and gender-based violence, social exclusion, and intersecting forms of discrimination. UNFPA advocates for increased access to quality mental health services, particularly for women and girls and adolescents, inter alia by eliminating intersecting forms of discrimination and other barriers hampering their effective access to services and promoting their active participation in the design and monitoring of policies, programs, and services on mental health. UNFPA would therefore like to encourage member states to promote, protect, and care for mental health and psychosocial considerations and their national response plans across relevant sectors, and to respond proactively to reducing pandemic-related adversities that are known to harm mental health, such as domestic and gender-based violence. I thank you.
Thank you, UNFPA. Several non-state actors in official relations with WHO have requested the floor on this grouping of agenda items. According to the privileges conferred by relationship with the World Health Organization, I have pleasure in giving the floor to the representative of the International Association for Hospice and Palliative Care. You have the floor.
WHA 73.1 commits member states to include palliative care in their pandemic preparedness and response strategies. To do this, planners can use the excellent existing WHO guidances on palliative care in humanitarian crisis response and clinical management of COVID-19. We urge you to inventory existing services and map care gaps for COVID and non-COVID patients with palliative care needs. We also urge you to stress test pharmaceutical chain suppliers to ensure access to critical palliative care medicines, many of which are in stockout or shortage, and to and to work on creating regional manufacturing hubs to provide these global goods. Internal staff, community health workers, nurses, and emergency care respondents should receive basic palliative care training, including in the use of opioids and patient communications. I thank you, chairs.
Thank you. I now invite Global Alliance for Improved Nutrition to take the floor. I now invite Caritas International to take the floor. Caritas, you have the floor. I invite World Confederation for Physical Therapy to take the floor. I invite the International Union for Health Promotion and Education to take the floor. I invite the Medicines Patent Pool Foundation to take the floor. Okay. Please, you have the floor. Medicines Patent Pool Foundation, you can proceed. Okay. We'll come back to you later. The United States Pharmacopoeia Convention, please, you have the floor. The International Commission on Occupational Health, you have the floor. The International Federation of Medical Students Association, you have the floor.
Honorable Chairperson, distinguished delegates, the International Federation of Medical Students Associations commends the WHO on its work to combat the COVID-19 pandemic, while also underlining that increased resilience is key to face future health emergencies more successfully. We recognize the undeniable global burden of physical and mental health conditions, which is further exacerbated by health emergencies, whose impacts are preventable by adequate preparedness. We call upon the WHO and member states to provide youth with more inclusive platforms, allowing our meaningful engagement in the formulation, implementation, monitoring, and evaluation of action plans, such as the updated Comprehensive Mental Health Action Plan 2013-2030, to secure strong post-pandemic recovery and improve resilience for future emergencies, while ensuring that vulnerable groups and key stakeholders, including youth, are not left behind. Thank you.
Thank you very much. I invite the Alzheimer's Disease International to take the floor. I invite the Alliance for Health Promotion to take the floor. I invite the Cochrane Collaboration to take the floor. I invite Water Aid International to take the floor. I invite the Union for International Cancer Control to take the floor. You have the floor, please proceed.
Many thank you. Many thanks, Chair. UICC, WCRF International and the NCD Alliance welcome the opportunity to contribute to this discussion, given the catastrophic impact of COVID-19 on people living with NCDs. We strongly urge Member States to take up the proposals made by the IPPR and the Pandemic Treaty, and we ask Member States for 6 actions. First, prioritise the continuation of essential services for cancer and other NCDs, including screening, diagnosis, access to treatment, and palliative care. Second, invest in comprehensive mental health services, provide support for health workforce, and ensure mental health services are prioritised in pandemic preparedness strategies. Third, increase the monitoring and data collection on NCD prevalence, comorbidity, and risk factors, and integrate these into readiness, resilience, and response measures, and identify high-risk groups such as older adults and those living with comorbidities, and people living with obesity. Fourth, include civil society and communities, including people living with NCDs, in the planning for the COVID response, recovery, and future preparedness. Fifth, make investments in health promotion and disease prevention to promote health resilience and resistance. And sixth, request and resource WHO to continue developing practical tools, guidance, and targets, which include actions to prevent the leading risk factors and maintain essential services for NCDs to ensure that Member States are well equipped to prevent and respond.
Thank you very much. World Obesity Federation, you have the floor. The Drugs for Neglected Diseases Initiative, you have the floor. Please, go ahead.
Thank you, Chair. So COVID-19 is enabling major scientific advances and the development of new health technologies. However, it is also exposing structural inequities that hinder innovation and equitable access. Urgent steps must be taken by Member States to course correct for COVID-19, to shift from a model where innovation is left to the markets to a model that delivers global public goods. This includes sharing supply of vaccines, support for the TRIPS waiver, CTAP, and technology transfer mechanisms, using leverage to ensure companies share know-how and technologies, and investments in all technologies, including therapeutics, as well as building truly global manufacturing capacity. In the longer term, for future pandemic preparedness, enabling policies must be put in place to ensure equal partnerships, as well as conditions on open knowledge sharing, tech transfer, and access. Thank you.
Thank you. I now invite Help Age International to take the floor. I would like to invite the International Council of Nurses to take the floor.
Thank you, moderator. The world has clearly seen that nurses are leading the COVID-19 response, delivering 90% of care, and it is nurses who have seen the weakness and fault line that must be addressed in the continuous response and in the design of the future health systems. In Resolution WHA 73.1, the World Health Assembly expressed its appreciation of and support for the dedication and sacrifices of health workers. Yet the unacceptable and unsafe working conditions, unfair pay for nurses, numbers of infections, and as Dr. Tedros noted, the over 115,000 deaths of healthcare workers, which is equivalent to more than 200 deaths per day, send a different message. The situation requires immediate intergovernmental action, transparent sharing of data on healthcare workers, infections and death, and placing healthcare workers at the center of the pandemic treaty. ASEAN called on Member States to urgently intensify action to protect, support, and invest in nurses and the health workforce, and to end this pandemic and make it the last. Thank you very much.
Thank you. I now invite Médecins Sans Frontières International to take the floor.
Hello. Yeah, thank you, moderator.
Je vous remercie, Madame la modératrice. Médecins sans frontières se félicite des discussions des États membres sur la préparation aux futures pandémies à la riposte et nous avons pris bonne note des conclusions et des recommandations. Nous aimerions toutefois rappeler que la pandémie de Covid actuelle n'est pas encore achevée et il y a des solutions urgentes qui doivent être mises en œuvre sur le terrain maintenant. Nous continuons à voir des flambées de cas de Covid dans le monde. Pas seulement ce qu'on voit aux informations dans les rues de Delhi, mais aussi dans des zones plus difficiles à atteindre, comme le nord-est de la Syrie. Il reste des inégalités majeures entre les pays en matière d'accès aux outils de lutte contre la Covid, qu'il s'agisse d'oxygène ou de vaccins. Le mécanisme COVAX a du mal à atteindre ses objectifs parce que les vaccins ne sont pas disponibles pour
the vaccine short shelf life and vaccine hesitancy, which must be addressed. Today, we need countries with vaccine surplus to donate to countries without access and enable willing actors to support. It is only when everyone, especially the most vulnerable, is guaranteed impartial and equitable access to COVID tools that we will have a chance to see this crisis over. Thank you.
Thank you. I now invite the European Society for Medical Oncology to take the floor.
The European Society for Medical Oncology is a global network of more than 25,000 cancer professionals from over 160 countries. ESMO welcomes the resolution on strengthening WHO preparedness for and response to health emergencies and encourages WHO to leverage resources developed by professional societies. For cancer, ESMO's COVID-19 and Cancer Portal provides recommendations for the management of cancer patients, educational resources, and a registry. The ESMO call to action on COVID-19 vaccinations and patients with cancer, endorsed by over 50 professional and patient organizations, requests member states to 1. Vaccinate all cancer patients in line with WHO principles and objectives. Patients with active disease or receiving anti-cancer treatment deserve an additional priority in case of limitations only. 2. Diligently collect data via suitable studies and registries to monitor the effects of vaccines in the vulnerable population, including patients with cancer and their immune response. 3. Educate and instill confidence among the public and patients in receiving the vaccines. Thank you.
Thank you. I now invite the International Association for Suicide Prevention to take the floor.
Hello. Thank you, Moderator. The International Association for Suicide Prevention encourages the sharing of research and evidence related to suicide prevention so as to strengthen and inform collective efforts to address this issue. COVID-19 continues to challenge countries the world over, and the mental health impacts may be felt for generations. Where contemporaneous data is available, a significant initial increase in suicide has not yet been seen, though some emerging data following subsequent waves is concerning. Current data does not provide a global picture accounting for the varied and significant challenges countries currently face, and we share concerns about the longer-term impact. We call upon member states to remain vigilant and reactive to changes in suicide trends and to include suicide prevention in COVID-19 response recovery.
Thank you. I now invite the Worldwide Hospice Palliative Care Alliance to take the floor. I would like to invite Knowledge Ecology International to take the floor.
Thank you, Moderator. Knowledge Ecology International asks the WHO's COVID-19 Technology Access Pool, CTAP-2. Number 1, publish model agreements for the sharing of rights in inventions, data, biological resources and know-how, including the components of full technology transfer that CTAP is seeking for each relevant technology. Number 2, hold bi-weekly public briefings where news media can hold the Secretariats, WHO member states, manufacturers and rights holders accountable. Number 3, consult with member states and propose best practices for transparency of R&D funding agreements, licenses and technology transfer agreements. KEI welcomes the establishment of the WHO COVID-19 mRNA Vaccine Technology Transfer Hub and asks the WHO to publish and periodically revise reports on global manufacturing capacity for each relevant COVID-19 medical technology, with commentary on necessary measures to bring facilities into GMP compliance. Thank you.
Thank you. I now invite Medicus Mundi International Network, Health for All, to take the floor.
Thank you, Chair. Dear delegates, what we have seen in the last week as concrete proposals for how to strengthen pandemic preparedness and response leaves us with mixed feelings. The report of the independent panel does not sufficiently address politically sensitive issues such as the grave human rights abuses in the COVID-19 response. However, we welcome the draft decision calling for convening a WHO special session to explore a WHO-based pandemic treaty. This might indeed lead the way forward if properly done. The special session shall be prepared by a member states working group to be set up under the Preparedness and Response Resolution. That resolution requests this group to work in an inclusive manner. We are keen to see what this means in practice. We herewith invite civil society organizations to come together to jointly draft a sound civil society input on requirements for a successful and transformative pandemic treaty in terms of scope, fundamental principles, and drafting process. And let us not give it up with engaging in WHO governance. Thank you.
Thank you. I now invite Public Services International to take the floor.
Thank you, Chair. Okay. Thank you, Chair. Wealthier countries have not upheld WHO Resolution 73.1's position for universal, timely and equitable access to and fair distribution of all quality, safe and efficacious technologies and products required for the pandemic response. Member states are urged to walk their talk, fulfill pledges to COVAX, break corporations' refusal to cooperate with CTAP, and support the TRIPS waiver on vaccines and therapeutics. We also call for the pandemic treaty to include automatic trigger of IP rights suspension when effect is declared. Governments must invest in public health and care to ensure crisis preparedness. Health and care workers must be protected in global health emergencies, including with application of the precautionary principle for IPC measures recommendations. Thank you very much.
Thank you. I now invite International Pediatric Association to take the floor.
The International Pediatric Association believes every child has the right to the health and the opportunity to fulfill their potential. The COVID-19 pandemic highlights the urgent needs for health and mental health services for the children, the need for accurate information for the professionals and the public, and the need for access to services for other health priorities as well as for COVID-19. Our National Pediatric Society members already see children and adolescents in crisis. The long-term effects of COVID-19 on physical and mental health, especially for vulnerable population, requires equity and justice for vaccine access, for physical, developmental, and mental health services. We urge member states to strengthen and coordinate efforts with WHO and child health professionals to include and prioritize mental health care in investment for COVID-19 and enact social protection program to support families so post-pandemic health systems are fully responsive to the children's need. Thank you, Chair.
Thank you. We have now come to the end of our NSA interventions. I see that the World Organization for Animal Health has their hand up, so please, you have the floor.
Yes, good morning. I hope you can hear me.
Go ahead, we hear you.
Thank you for giving me the floor. On behalf of the World Organization for Animal Health, I thank the Director General of WHO for inviting the OIE to participate in the 74th World Assembly. The OIE is actively engaged in supporting its members and international partners by leading the response to the animal-related aspects of COVID-19. This includes publishing science-based guidance on managing risks at the animal-human interface, research to better understand the risks at this interface, along with collecting and disseminating information on the occurrence of SARS-CoV-2 in animals. In addition, assessing our initial response through an after-action review and launching a wildlife health framework to better manage the risks of disease emergence whilst protecting wildlife health. OIE continues to work with members to learn from COVID-19, to strengthen global capacity for emergency management, and to better prepare for future threats at the human-animal environment interface. Since most emerging diseases of humans have an animal origin, it should be no surprise that it is almost certainly the case with COVID-19, even if its route of entry into the human population remains obscure. Therefore, COVID-19 is a critical reminder that the OIE and its members stand in the front line of managing the risk of disease emergence at the human-animal interface through a One Health approach. The OIE will continue to cooperate with the WHO Academy through a specific task force for strengthening the capacity of members to implement One Health in the field. Our organization also welcomes the newly established One Health high-level expert panel set up by FAO, OIE, UNEP, and WHO to provide scientific advice and guidance on One Health. With regards to the objectives of the draft decision mentioned in document A74A Conf 7, as well as the draft resolution on strengthening WHO preparedness for and response to health emergencies, the OIE will closely collaborate with WHO, FAO, and UNEP to ensure that any new international legal instrument for pandemic preparedness response, if progressed, is well grounded in a One Health approach and promotes a continuous improvement to intelligence systems, response mechanisms, evaluation processes to be made available for our members' benefit. In this regard, OIE would like to be invited to participate in further discussions. In conclusion, the OIE reiterates its thanks to the WHO and other partners and confirms its continued role in strengthening our partnership and contributing to managing zoonotic risks. I thank you again for allowing the OIE to take the floor.
Thank you, OIE. I now hand back to Madam Chair.
Thank you very much. I shall now ask the Secretariat to respond. I now give the floor to the Regional Director for the Eastern Mediterranean, Dr. Ahmed Al-Mandari. Dr. Al-Mandari, you have the floor.
Thank you very much, Madam Chairperson. The COVID-19 pandemic is the defining event of our lifetime. Nothing over the past 7 decades has demanded so much from us or our citizens, communities, private industries, governments, and global institutions. We cannot afford 1 second of complacency. Through unprecedented solidarity, equity, and multilateralism, we are tackling an enormous range of technical and operational issues. But we are still struggling with vaccine nationalism, vaccine hesitancy, widespread misinformation and disinformation, insufficient funding, and politicization of a pandemic that should bring unity, not division. And we cannot ignore the many other emergencies across the globe. Currently, WHO is responding to 65 other graded emergencies. 15 of these are in the Eastern Mediterranean region, including 9 major humanitarian emergencies. Over 100 million people in our region need humanitarian assistance, which represents 43% of the global total. The vast majority are caught up in intractable conflicts in countries such as Afghanistan, Somalia, the Syrian Arab Republic, and Yemen as well as the occupied Palestinian territory. They deserve our solidarity along with political, financial, technical, and operational support. WHO is applying innovative approaches, including the humanitarian development peace nexus, referral pathways for violent trauma, and health as a bridge for peace. As in our fight against COVID-19, we cannot overcome humanitarian crisis without strong and human political leadership. Poor governance has contributed to the spread of the pandemic and many other emergencies. An epidemic of poor governance has been the main contributor to humanitarian crisis across our region and beyond. As public health practitioners and humanitarians, we are playing our role in preparing for and responding to health emergencies, whatever their causes. But we need our political leaders to play their role as well. to invest in health systems and preparedness, and to find a pathway or a path to sustainable peace and prosperity for the hundreds of millions suffering from conflict worldwide. I thank you, Madam Chairperson.
Thank you, Dr. Al-Madghari. I now give the floor to the Regional Director for Europe, Dr. Hans Kluge. Dr. Kluge, you have the floor.
Ladies and gentlemen, dear friends, most of us have felt the pandemic's impact on mental health. A survey found that 120 out of 130 countries reported significant service disruption for mental, neurological, and substance disorders. This at a time when demand for these services was increasing. A recent 78-country survey shows that 50% of the population only has moderate mental health. The support for action on mental health is unequivocal and growing. Harnessing this momentum, the WHO Europe is launching initiatives to respond to the mental health impacts of COVID-19, using innovative solutions to long-standing issues. This crisis requires us to take stock of past shortcomings and, as the Pan-European Commission on Health and Sustainable Development is doing, mend the fractures in society, leaving no one behind. Even before the pandemic struck, WHO Europe identified mental health as a flagship program of the European Programme of Work 2020-2025. A new European framework for mental health is being developed in consultation with the Member States. A technical advisory group is reviewing the evidence and identifying needs and implications for mental health service development and system strengthening as a key component of the recovery. The group's findings will be presented at the International Athens Summit 22-23 July 2021, conveyed by the Greek Ministry of Health and WHO Europe. At the Regional Committee 71 in September, a political resolution will be presented to build societies that promote mental health as part of the economy of a well-being agenda. The Pan-European Mental Health Coalition, under the auspices of Queen Mathilde, Queen of all Belgians, will be launched around World Mental Health Day in October. The coalition will be an engine for breaking barriers, advocating for mental health rights, and convening those who never had a seat at the table. A silver lining of the crisis is an opportunity to forge a new pathway for mental health promotion and care. Now is the chance to drastically transform mental health care. Let's grasp it. Thank you.
Thank you very much, Dr. Kluge. I'll now give the floor to Dr. Ren Mingui, Assistant Director General, Universal Health Coverage, Communicable and Non-Communicable Disease, to take the floor. Dr. Ren, you have the floor.
Thank you, Madam Chair. I would like to thank all your comments and suggestions on item 18. As planned, my response will also cover mental health related comments you have made during the discussion on item 13.2, political declaration of third high-level meeting of General Assembly on prevention and control of NCDs. All member states agree during this assembly that maintaining the state course in preparedness and response to the pandemic is not an option, neither for mental health services. Even though we hear some good example, for instance, from Bangladesh, Brazil, Cambodia, Cuba, Kenya, Spain, and Tunisia, just name a few, providing mental health services and psychosocial support in the pandemic response. COVID-19 exposed limited investment in mental health preparedness and infrastructure in all countries before the pandemic. The most recent pulse survey by WHO showed the mental, neurological, and substance use services was the most common reported as disrupted, particularly service to the most vulnerable groups. There are many other vulnerable groups that would require urgent scaling up of mental health services now and for many years to come, including, for example, COVID-19 patients and their families, health workers and their frontline responders, people living in humanitarian settings, people with pre-existing mental, neurological, and substance use conditions, young people, and older adults. Mental health disorders cause significant economic, social, and health burden due to lost economic outputs and link between mental health disorders and potentially vital conditions, including communicable and non-communicable diseases. COVID-19 is likely to increase these burdens and leads to development, exacerbations, and relapse of burden a range of mental disorders. WHO is playing a leading role in mental health emergencies during the last 2 decades, in interagency coordinations, setting norms and standards, and supporting countries' operations in mental health and psychosocial support in emergencies. WHO secretaries responded earlier to the mental health consequences of a pandemic with global interagency mental health and social support coordination core and published resources since February 2020. The resources developed by WHO secretaries cover a wide range of populations' needs and various age groups and was translated into dozens of languages and contributed to shaping good practice in numerous countries. Last year, together with standby partners, WHO launched the first interagency rapid mechanism to deploy the experts of mental health and psychosocial support to more than 20 countries today. I want to thank Thailand for initiating this discussion and development of EB Decision 140A3, emphasizing timely and quality provision of a full range of mental health services and psychosocial support as an integral part of a health system, as a part of a whole of the society approach. Thank you, the Netherlands, for your support in hosting a high-level meeting on mental health and psychosocial support, and we are looking forward to the productive meeting and discussion on June 11. Investment in human and financial resources for the full implementation of a comprehensive, updated mental health action plan until 2030 to build resilient mental health systems, prepared for future emergency, and to enable to respond to the current crisis is our joint way forward to achieve the decision. Thank you, Japan, for what you highlight. We can't call global health without mental health. We will launch the Live Lives initiative for suicide prevention next month. Most grateful for your support. Thank you, Slovenia and Colombia, for mentioning alcohol and substance use, which is very important elements in the mental health agenda. As you may recall, the decision EB 146/14 requests DG to develop an action plan on alcohol for consideration by the 75th World Assembly through the 105th EB 2022. Now the action plan is under development in consultation with broad range of stakeholders as requested. 6 regional consultations with member states has been recently conducted. And the first draft of the action plan will be made available for another round of broad technical consultation next month. A web-based consultation on working documents for the action plan has received 253 submissions with more than 1,300 pages of text. I thank you all for your inputs. the Global Safer Initiative, aiming at support countries in their implementation of the best buys policy options to reduce the harmful use of alcohol, is currently rolled out and made available for all countries. We also hear your concern on the Secretariat's capacity. We will continue to work with donors and partners to ensure the WHO technical capacity, particularly in the regional and the country levels, could be strengthened in order to better provide technical support to the member states to promote and expand access to integrate evidence-based primary and community mental health services and psychosocial support in the context of COVID-19 pandemic response and for future public health emergencies preparedness, response, and recovery. It's our joint vision and plan for building back better and sustainable mental health services accessible to everyone, everywhere. With that, I thank you, Madam Chair.
Thank you very much, Dr. Ryan. I understand that Dominican Republic wishes to take the floor. If Dominican Republic is available, you can take the floor.
Yes, thank you very much. Thank you very much, Madam Chair. I apologize for taking the floor a bit late in the day, but I was a little bit confused regarding the procedure, since we asked delegations once again to take the floor on the topic that is focused on resolutions and decisions. Now, we would like to make our statement on these resolutions and decisions, if the chairman allows us to.
Proceda.
Go ahead. Yes, regarding the draft resolution on the strengthening preparedness for health emergencies, just as the draft decision in which we make an appeal to have an extraordinary meeting, a special session of the World Health Assembly, the Dominican Republic co-sponsors both of these draft decisions. We do think that it is absolutely urgent and necessary to take measures and implement policies that allow us to deal with this pandemic and to deal with the repercussions of the pandemic. We must create policies and tools that allow us to better prepare ourselves for the future pandemics that might arise. We do think that it is urgent and especially important that at the national level, regional level, as well as at the international level, we support the recovery from COVID-19 through the promotion of mental health and well-being, as well as psychosocial well-being. In line with this, we support the review of the Action Plan on Mental Health 2013-2030 to make sure that it is better integrated and that it provides us with the tools that are necessary to become more resilient at the international level. Healthcare and literacy of mental health, as well as raising awareness on mental health issues and reducing stigmatization, as well as the promotion, prevention, early detection, treatment, and rehabilitation efforts are some of the aspects that are the most pertinent that must be taken into account when it comes to working in the mental health area. We highlight the importance of developing innovative technologies, including remote mental health services through the promotion that should be equitable to telehealth and other essential activities. Therefore, we support this draft resolution on the strengthening of preparedness for health emergencies and mental health preparedness. We're very pleased that mental health has been included in this draft resolution because it is of extreme importance. Thank you. Thank you to the Dominican Republic.
I now invite Dr. Michael Ryan to take the floor. Dr. Ryan, you have the floor.
Thank you. Thank you, Chair. And thank you to all the member states who intervened on these issues. You've all highlighted very important issues, challenges, and may I say opportunities for us all going forward. And certainly the resolution proposed has very, very detailed recommendations both to WHO itself, the Secretariat, and to to member states. The trick now will be in implementing those and sustainably financing all of those recommendations in the resolution. Many of you have highlighted the importance of this continued international cooperation and solidarity, the importance of having a local, national and global focus. Global solutions are needed, but we need to build from the local up. You've highlighted the importance of predictable financing, of a stronger, more capable and better supported and protected health emergency workforce. The importance of surveillance at all levels. And many of you spoke to the issues of fragility, conflict and vulnerability, countries in which health infrastructure, surveillance infrastructure is weakest. It is important to note that over 70% of high-impact epidemics occur in 30 fragile, conflict-affected and vulnerable countries. And many global threats can begin very locally in those circumstances. We will not achieve the SDGs unless we deal with child and maternal mortality in fragile and conflict. We will not achieve global health security unless we fundamentally address the fragility and challenges of public health preparedness and response in fragile, conflict-affected and vulnerable settings. Right now, the pathogens have the upper hand. They're emerging more frequently and often silently in a planet that's out of balance. And as we've seen with Ebola, we've seen with other diseases, they can amplify and spread in our communities and our healthcare facilities, unknown, unseen and undetected, until they then spread within countries and between countries, endangering all of humanity. They sicken and kill us and disrupt every aspect of our lives. They exploit our interconnectedness. They expose our lack of coordination, our lack of solidarity, our societal inequities. In short, the pathogens are winning this fight right now. And that should not be the status quo, and it should not be something we accept. And therefore, we really do welcome the recommendations within the resolutions and also the proposed decision to take this forward to an international agreement or framework convention on preparedness and response for pandemics. We do need to turn those weaknesses into strengths. We need to turn that very thing that has exposed us in this pandemic, our interconnectedness. We need to turn that into a strength. We need to build a better workforce capacity and make it mobile and redeployable. We need to build a better global surveillance system based on fundamental strengthening of local and national systems. We need to build better research and innovation as well as more responsive supply chains. We need to provide more sustainable financing to drive preparedness and distribute those resources in a fair and equitable manner. For me, it is about connecting. It's about connecting local to global and to local again. It's about connecting human, animal and planetary health. It's about connecting our health emergency workforce around the world, connecting our data, connecting our research, connecting our innovation, connecting our finances. Only then will that great weakness we have, our interconnectedness, become our great strength. The World Health Organization is your organization. It is defined by its mandate and constitution to be that connector between member states and to design and implement policies and strategies that will keep all of our communities safe. Finally, in reflecting on what Ben said on mental health, we would like to fully endorse that from the emergencies programme perspective. The mental health team do fabulous work with us and lead on very, very difficult work in what are already difficult circumstances. This year, the Grand Prix in Health Emergencies category for the WHO Film Festival was actually won by a film called Stressed, a Pandemic of Fear, which was based on the mental health experience of children in camps in the Middle East and in Jordan specifically. And this did describe the alarming levels of stress and mental health amongst forcibly displaced children, especially in the era of COVID. So in that sense, we would like to very much second and thank member states for this work on mental health, particularly in children and particularly in those children who are already in fragile and vulnerable situations. Lastly, Just a word of thanks to you, Member States, to all your institutions, academic, scientific and operational, who have worked so well with WHO and the UN system over the last year. Our incident management support teams at all levels of this organisation, the leadership of our regional directors, the regional platforms, especially our country teams, who have worked tirelessly, very often isolated from the normal ability to connect with us, have done tremendous work. All of the pillars of the response, all of the programmes here at headquarters, this response has not been driven by the emergencies programme. We connect the dots, but to the DDG, to everyone in all of the other programmes who've not only provided staff and input and people, also kept other really, really important aspects of WHO's work underway and continued implementation even in the face of this pandemic. I trust that we will be able to move forward now with greater direction from you. I thank you for your guidance. We thank you for your guidance and your direction, and we look forward to implementing all of the recommendations in your resolutions. Thank you.
Thank you very much, Dr. Ryan. The committee is now invited to know the reports contained in document A74/9, A74/10, Revision 1, and A74/17. The reports are noted. We will now consider the draft decisions and resolutions. First, we will consider the draft decision contained in paragraph 13 of document A74/10, Rev 1, on the Comprehensive Mental Health Action Plan 2013-2030. The financial and administrative implication of this decision may be found in document A74/10, Rev 1 at 1. Is the committee ready to approve the decision? I see no objections. The decision is approved. We will now consider the draft decision contained in document A74/17 on the implementation of the International Health Regulations 2005. The financial and administrative implication of these decisions may be found in document A74/17 at 1. Is the committee ready to approve the decision? I see no objections. The decision is approved. We will now consider the draft resolution contained in document A74/A/conf/2 on strengthening World Health Organization preparedness for and response to health emergencies. The financial and administrative implication of this decision may be found in document A74/A/conf/2 at 1. Is the committee ready to approve the resolution? I see no objections. The resolution is approved. We will now consider the draft decision contained in document A74/A/conf/7 entitled Special Sessions of the World Health Assembly to consider developing a World Health Organization Convention, Agreement, or other international instrument on pandemic preparedness and response. The financial and administrative implication of this decision may be found in document A74/A/conf/7 at 1. Is the committee ready to approve the decision? I see no objections. The decision is approved. I will now allow to give the floor to the Director General for some remarks. Dr. Tedros, you have the floor.
No, thank you so much. I think my colleagues have said all the important issues that were raised by our member states. But I will do just two things. One, I would like to thank our member states for endorsing the decision and the resolutions. Thank you so much indeed. Merci beaucoup. And the second part is, as you know, one day this pandemic will be over. But many of the psychological scars linked to the pandemic will stay with us for a long time. What's happening is mass trauma because the whole world was affected. So paying attention to mental health will be very, very central. And that's why we're working in all levels, our regions and our country offices, to strengthen the things we do, especially with regard to mental health. And that's what I would like to stress. Please, let's give mental health a serious priority, and it has to be central. The impact of this pandemic on mental health is very, very palpable. And I know it affected majority of the world population. Of course, even before COVID, we have been saying no health without mental health. But now it's even more clear because of the impact of the pandemic. And the pandemic's impact, not because it directly impacts health, but it also, as you know, impacts livelihoods, and that's why it's impacting mental health. So, through both direct and indirect impacts. So that's the only thing I would like to underline. On the other issues, I will be doing the closing, and then I will say more during the closing. So with that, Madam Chair, muchas gracias. Back to you.
Thank you so much, Dr. Tedros. Muchas gracias, Dr. Tedros. The agenda item is now closed. Distinguished delegates, ladies and gentlemen, we have now completed our very full agenda. The discussion has been rich and productive. I thank you all for your cooperation and for the valuable inputs. It has been a great pleasure and an honor to work with our Vice Chair, Dr. Sueli Miske from South Africa, and Dr. Ali Mohammed Mifat Al-Sinati from Libya, and our Rapporteur, Professor Plamen Dimitro from Bulgaria. And thanks also go to the Chair of the Program, Budget and Administrative Committee, Dr. Faisal Ben Salah. Sorry, 1 second. I should now give the floor to our reporter, Professor Dimitro, before carry on with the last remarks, who will read the full and final report of Committee A. Professor Dimitro, if you are available, you have the floor.
Thank you, Madam Chair. Fourth report of Committee A. Draft. Committee A held its 12th meeting on 31st of May 2021, chaired by Dr. Adriana Maria, Paraguay. It was decided to recommend to the 74th World Health Assembly the adoption of the attached 3 decisions and 1 resolution relating to the following agenda items. Pillar 2, 1 billion more people better protected from health emergencies. Agenda item 11, mental health preparedness and response for the COVID-19 pandemic. 1 decision. Agenda item 17, public health emergencies, preparedness and response. Agenda item 17.4, implementation of the International Health Regulations 2005. one decision. Agenda item 17.3, WHO's work in health emergencies. One resolution entitled Strengthening WHO Preparedness for and Response to Health Emergencies. One decision entitled Special Session of the World Health Assembly to consider developing a WHO convention, agreement, or other international instrument on pandemic preparedness and response. Madam Chair, back to you.
Thank you, Professor Dimitrov. I understand the committee is willing to adopt this report as read out. Are there any objections? I see no one. The report is adopted. We have now finished the agenda items, and I would like to say some few remarks. Distinguished delegates, ladies and gentlemen, we have now completed a very full agenda. The discussion has been rich and productive. I thank you all for your cooperation and for the valuable input. It has been a great pleasure and an honor to work with all of you, and especially with our Vice Chair, Dr. Sweli Miske from South Africa, Dr. Ali Mohammed Mifa Al-Sinati from Libya, and our reporter, who just took the floor a few minutes ago, Professor Plane Dimitrov from Bulgaria. And thanks also go to the Chair of the Program, Budget and Administration Committee, Dr. Faisal Ben Salah. On your behalf, I would like to thank the representative of the Executive Board who have assisted us in our deliberations. My thanks also go to Director General Dr. Tedros for his timely interventions, and to the regional directors and the whole World Health Organization leadership team, who have provided us with in-depth responses. My sincere gratitude to the Secretariat of Committee A for the invaluable assistance in ensuring the smooth running of our meetings. I would like to thank our interpreters and translators who have facilitated the communications between us, and to the numerous IT staff working very hard to ensure that we can connect to each other. I would also like to thank all the hardworking personnel of this organization who continue to work tirelessly in response to this pandemic, while ensuring the continuity of work on other health needs around the world. It is great appreciation that I thank you all for your patience and flexibility as we once again conduct a health assembly through a virtual platform. The last meeting of Committee A is now closed.
Thank you, Madam Chair, for your able leadership.
Thank you so much to all of you, and thank you to Raquel as well. Thank you very much.
Thank you.